Good morning, wherever you are. This is Nova Quinn from ConferenceHype. Our segment will focus on international experience with implantable cardioverter defibrillators for the prevention of sudden death in high-risk patients with hypertrophic cardiomyopathy. From the 2026 August 25 edition of Circulation. Background: Raynaud phenomenon, a vascular disorder affecting the small arteries and arterioles of the extremities, is characterized by episodic vasospastic attacks. Methods: in primary RP, these episodes cause changes in skin color, ranging from white to blue due to reduced tissue perfusion, followed by red upon reperfusion, often triggered by environmental factors or emotional stress. Results: RP is classified into two major types, PRP and secondary RP. Discussion: this scientific statement reviews current evidence on quality of life measures for individuals with RP and on medical management, botulinum toxin therapy, and surgical intervention for severe cases. From the 2026 August 25 edition of Circulation. Background: hypertension is a major risk factor for cardiovascular diseases. Methods: we assessed RNA M6A changes and METTL expression in hypertensive aortas via methylated RNA immunoprecipitation sequencing and RNA sequencing. Results: under hypertensive stress, METTL7B expression positively correlated with global RNA M6A content, exhibiting concurrent depletion in VSMCs. Discussion: collectively, our study identifies a novel RNA M6A methyltransferase, METTL7B. From the 2026 August 18 edition of Circulation. Background: patients with peripheral artery disease are at high risk of major adverse limb events and major adverse cardiovascular events. Methods: clear outcomes randomized 13,970 patients to bempedoic acid 180 mg or placebo from December 22, 2016 to August 14, 2019. Results: a total of 1,624 of the enrolled patients had PAD at baseline. Discussion: patients with PAD are at high risk of males and MACEs. From the 2026 August 18 edition of Circulation. Background: in select, semaglutide effects on heart disease and stroke in patients with overweight or obesity. Among 17,604 patients with known atherosclerotic cardiovascular disease and overweight or obesity, but not diabetes, randomization to the glucagon-like peptide 1 receptor antagonist semaglutide significantly reduced the primary outcome of major adverse cardiovascular events compared with placebo. Methods: in this prespecified select substudy, we evaluated whether baseline hsCRP levels predicted MACE risk and examined the relationships between changes in hsCRP levels and time to first MACE, baseline body weight, weight loss, and other clinical measures among treatment groups over time using multiple approaches, including Cox modeling. Results: baseline hsCRP level, which was similar in the semaglutide and placebo groups, was prognostic of future MACEs. Discussion: in select, hsCRP data at baseline, and in response to treatment with semaglutide support inflammation as a potential prognostic factor, associated with cardiovascular risk in these generally well-treated patients with atherosclerotic cardiovascular disease and overweight or obesity, but not diabetes. From the 2026 August 25 edition of Circulation. Background: pulsed field ablation of atrial fibrillation has been rapidly adopted, partly because of safety expectations compared with thermal ablation. Methods: we conducted a prospective registry analyzing consecutive atrial fibrillation ablations at a high-volume U.S. academic center between 2022 and 2026. Results: a total of 42 21 ablation procedures, 2077 RFA and 2144 PFA, 68.7% Farawave, 23.3% Sphere 9, 6.9% Varipulse, 0.7% Pulse Select, was performed by 12 operators. Discussion in a high-volume, single-center registry with high clinical granularity and systematic patient follow-up. PFA was associated with a significantly higher risk of stroke TIA at 30 days compared with RFA. From the 2026 August 18 edition of Circulation. Background: the role of leukocytes in the pathogenesis of right ventricular dysfunction associated with heart failure with preserved ejection fraction remains poorly defined, partially due to the lack of suitable small animal models. Methods: young and aged male and female C57BL6J mice were divided into 4 experimental groups: CHOW, HFpF, chronic hypoxia, and HFpF plus hypoxia. Results: RVHFpF resulted in left ventricular diastolic dysfunction, indicated by increased EE ratio, reduced global longitudinal peak strain, smaller end diastolic diameters, and increased isovolumetric relaxation time compared with CHOW. Discussion: we demonstrate that dysregulated myeloid cell dynamics are associated with, and directly contribute to, the pathogenesis of RVD associated with HFpF in humans and mice. From the 2026 August 25 edition of Circulation. Background: cardiogenic shock is defined by inadequate blood flow to vital organs because of cardiac insufficiency, and is often, but not always, manifest by hypotension. Methods: in an effort to mitigate end-organ hypoperfusion and modulate blood pressure, medical management with vasoactive agents is the initial strategy in virtually all patients with cardiogenic shock. Results: this clinical primer describes the pharmacologic profiles of the currently used vasoactive agents and available comparative effectiveness data, reviews the pathophysiology of the most common phenotypic forms of cardiogenic shock, and provides a strategic framework for vasoactive agent selection and titration that integrates the pharmacology, pathophysiology, and hemodynamic derangements that define each shock phenotype. Discussion: the practice-based approach to vasopressor selection strategy for the management of cardiogenic shock outlines the following steps. First, emergently protect the mean arterial pressure. Then, define the hemodynamic phenotype of cardiogenic shock and identify potential etiologies and contributors. Next, set additional hemodynamic goals beyond mean arterial pressure. Last, tailor pharmacotherapy through iterative assessments of perfusion and ongoing hemodynamic derangements. ConferenceHype is interactive AI commentary only. It is not reporting, journalism, medical education, clinical guidance, scientific validation, legal advice, or financial advice. ConferenceHype is independent and is not affiliated with conference organizers, presenters, sponsors, or exhibitors. From the 2026 August 25 edition of Circulation. Background: current dietary guidelines are largely based on evidence from the general population, and data on dietary patterns and survival after myocardial infarction remain limited. Methods: we included 3,277 women from the Nurses' Health Study and 2,618 men from the Health Professionals Follow-Up Study who survived a non-fatal MI. Results: during 15.7 years of follow-up after MI, 3,858 deaths were documented, including 1,639 cardiovascular disease deaths. Discussion: among individuals who survived MI, adherence to post-MI dietary patterns emphasizing higher diet quality was associated with better long-term survival. From the 2026 August 25 edition of Circulation. Background: myocardial infarction can cause a massive loss of functional cardiomyocytes, yet effective strategies to stimulate cardiac regeneration remain lacking. Methods: transcriptomic profile from 5 regeneration models, including AUC-TD tomato cytokinesis reporter mice and Mi6-Mer-Cre-Mer mosaic analysis with double markers, and cross-species comparative analysis were used to explore the regulatory networks for cardiomyocyte proliferation. Results: integrative multimodal analysis revealed a dual regulatory control system for cardiomyocyte proliferation, along with key associated genes and transcriptional regulators. Discussion: this work documents a dual control paradigm of cardiomyocyte proliferation and establishes NFib/NR3C1 cointervention as a putative new therapy to induce and control cardiac regeneration after injury. From the 2026 August 18 edition of Circulation. Background: clonal hematopoiesis of indeterminate potential has been associated with cardiovascular disease, but its relationship with silent brain lesions and cognitive decline in patients with atrial fibrillation is unclear. Methods: in this prospective, multicenter cohort study, we included 1,572 patients with AF enrolled between 2014 and 2017. Results: among 1,572 patients with AF, 342 carried CHIP sequence variations, most commonly in DNMT3A and TET2. Discussion: in patients with AF, CHIP was independently associated with a greater burden and progression of silent brain lesions and with accelerated cognitive decline. From the 2026 August 25 edition of Circulation. Background: APO-AI glycation has been implicated in HDL dysfunction, but its site-resolved landscape, clinical relevance, relationship with diabetic atherosclerosis, and underlying mechanisms remain incompletely defined. Methods: we performed unbiased site-resolved glycation proteomics in 860 patients with type 2 diabetes and coronary atherosclerosis, and 294 controls with type 2 diabetes without CAS to define the plasma APO-AI glycation landscape. Results: APO-AI glycation patterns differ between patients with type 2 diabetes with and without CAS, with K96 and K106107 emerging as prominent disease-associated glycation sites. Discussion: this study provides a comprehensive site-resolved map of APO-AI glycation in patients with diabetes and identifies the APO-AI glycation index as a glycation signature associated with diabetic CAS and impaired HDL function. That's it for now for ConferenceHype's coverage of the August 2026 issue of Circulation. If anything was missed, tell us which article deserves follow-up. Tag us on X. Add your perspective in the comments, share this review with your clinical team, like the video, and subscribe with notifications turned on for the next journal broadcast.